I'm delighted to welcome today David Rose, who is based in England in Essex area. And David has a very rare condition. In fact, you were just telling me, David, that there's only 7 people in the whole world with your condition. So welcome, and please tell us what the condition is and all about it. And we'll go into your background in a little while, but I'm intrigued to learn a bit more about this condition first of all.
Yeah, thank you so much for inviting me, Elaine. It's a pleasure to be here today. So my name's David Rose. I'm 34 and I live in Essex. I have a really ultra rare disease called occipital horn syndrome. I found 6 other people in the world with it currently. So as far as I know, there's maybe 7 of us and maybe slightly more, but there won't be many more than that. I was diagnosed with this about 7 years ago in Cambridge at the genetics department. Previous to that, I had a more common diagnosis, which we can talk about as well. So I had a slight change in the diagnosis of what I actually had. But yeah, it's been a big impact on my life, and very happy to go into all the details of all the good parts, all the sad parts. I think this is the thing with rare disease and long-term chronic illnesses, is they impact literally everything. It's not just the health side, it's the relationships, friendships, work, life, education, literally everything. So and obviously this rare disease that I have does affect everything. It affects all of my organs, it affects my muscles, my bones, fatigue, memory, mental health, kind of literally every tick box you can think of.
Wow, that's pretty far-reaching, isn't it? So yeah. So you had so you're 34 now. You had the diagnosis a few years ago. So what kind of childhood did you have then? Not knowing what was going on, I suppose it must have been quite disruptive.
Yeah, so I did have a diagnosis. When I was 3, I got diagnosed with something called Ehlers-Danlos syndrome, which is now becoming quite well known. It's still a rare disease, but certainly when I was 3, which is obviously 30 years ago, no one really knew much about it at all. And this was kind of pre-social media, so you couldn't connect to people like how we've connected. And it was the rare disease and chronic illness landscape was very different then, because you only knew about support groups or things like that. It wasn't as easy as it is now to search on Instagram or LinkedIn for any different health condition. You can find anything about it, whereas obviously 30 years ago it was so different. So growing up, I thought I had something called Ehlers-Danlos, which I still kind of do it. So the occipital horn syndrome, which I actually have, used to be considered one of the really rare subtypes of Ehlers-Danlos. I think there was about 11 subtypes, and then about 6 or 7 years ago, they changed the criteria, so they got rid of a few, and the thing that I actually have kind of became its own separate condition. So 30 odd years ago, the doctors were kind of on the right lines, but not specific enough, if that makes sense.
Interesting how things change over time. My father died in 1976 with cancer, a rare form of bone cancer called sarcoma, which still is rare today. And in those days, nobody knew what to do. Everybody, was whispering. But nobody had cancer. It was like where did that come from type of thing. We now know where it came from and how it manifested, but that's another story. So the way the science and medical profession has gone over the last few years is really quite amazing, isn't it? And thankfully so.
Yeah, no, I agree. I think people rightly have different opinions on what they think is a good sort of service wherever they are, and I think that mostly I've been very lucky. I think a lot, especially sort of during COVID, like it's been very disruptive living with various health conditions. Things haven't been going in the right direction in terms of appointments and things, but purely in terms of research and things, we're very lucky. 30 years ago it was very different to what it is now, even just 30 years ago. So the situation that we're in now, like, it will be great to see what 30 years from now looks like. If we're kind of going in this upwards trajectory, how will patients that are my age in 30 years, what will their life look like? And hopefully, touch wood, it'll be good.
So how does the condition affect you?
It's like I said, it's very sort of multi-systemic. So it sounds very cliche, but every day is very different. So sometimes I quite literally can't get out of bed, whether that's from all of my joints flaring up, or I get a lot of fatigue with the condition. So, and it's obviously painful every day. I get a lot of kidney infections and bladder infections as well. I have something called POTS, which is it's not rare as such, but it's quite common in quite a lot of connective tissue disorders and other rare diseases. So POTS is a shortened name for a long thing called postural orthostatic tachycardia syndrome. So it's lots of different things and it affects everyone very differently. But the way that it impacts me mostly is the dizziness and the sort of nausea that comes from it. So when I'm sitting or laying, my pulse is very low. And then when I stand up and change position, it kind of raises very quickly. And obviously it causes lots of different symptoms. So the POTS side of my life is obviously very different every day. Some days you don't really notice it. And I can go to the gym and I can swim and do the kind of normal things. And then other days just moving like literally from the bed to, the bathroom makes me feel horrendous. So I think it's, it is very cliche in the sense that it's different every day, but, I have good and bad days. And I think that I'm probably guilty of what a lot of people try and do is when you have a good day, you try and maximize it and you do all your cleaning and you try and catch up on life admin, you try and blitz for all the work you've got to do. And then the next day you feel terrible. You think you should have maybe paced a little bit better. But, I think that's something that you learn as you go. And, I've had help over the years with pacing and seen like cognitive behavioral therapists and physios and people like that have kind of tried to implement it. But it's like, as like it's very easy to kind of plan things, but then your day changes anyway and you have certain commitments that you can't get out of, or something comes up and you feel like you need to push yourself to do it. So I think our bodies are very complicated and we can kind of do what we can, but I think we have to appreciate that not every day is a simple one.
Absolutely. How was your schooling affected, David? It must have been quite difficult.
Yeah, it was. And I don't think I realised how difficult it was actually until I've looked back at it now. So, obviously it was 25 years kind of since I was at primary school and secondary school. And, kind of growing up, I'd always had that kind of thing where, I wanted to be like everybody else. And I still went on school trips, still did sports, still, did everything else like everyone else was doing. But looking back on it now, like I was really struggling. I think with the fatigue, especially, obviously I missed a lot of education through surgeries or hospital appointments and things. I was kind of in and out of school quite a lot anyway, whether that is for hospital or just being poorly at home. But I think that, I did struggle and I think it was quite hard to keep up. And, at the end, I always remember like now looking back on it, like especially from secondary school. So for your audience that might not know, like from 11 to 16, that kind of age range, a lot of the fatigue that I had, I think even though they knew I had health conditions, I think a lot of it, they were like, oh, it's growing pains, it's just being a teenager. And you hear that kind of response quite a lot, which is something we can talk about. But I didn't really realize kind of how much I was struggling at secondary school until I look back on it now. Like every day I felt horrendous when I came home, and you knew that you had to do it every day to keep going with it. And it's fatigue is such an awkward thing to get out of. It's not like pain where to some extent you can take a morphine or you can take a strong painkiller and it might subside it. Like there's literally nothing you can do about this fatigue. And I think that's something that really impacted my education, certainly from that age range, sort of 11 to 16 or so. That was definitely the worst of it. So yeah, it was difficult. I think I kind of flourished more so at sixth form and universities. Certainly kind of my grades in terms of that were much better at university. I think it was because I could manage my own time very differently, whereas at secondary school and primary school, these are the hours you're working at school and that's it. It's kind of non-negotiable, whereas you kind of manage your own time a little bit differently when you do a degree. And I think that's where I flourished. So I think to me that kind of makes sense. I think when you're in charge of it yourself, you can do weird hours. If you're awake from midnight till 4 a.m. and you feel like you can do something, then go for it. But whereas at secondary school you couldn't do that. So it was like everything that seems to be happening in my life, it's a learning curve. And I just so happened to flourish at university and found something that I actually enjoy doing as well, which I think makes a big difference. Doing something daily which you have no interest in is hard, whereas actually if you're studying something that you actually really enjoy and you've paid to be there and you're choosing to do it, it's a different environment, I think.
Absolutely. What did you do, David? What topic?
So I studied economics and business, which was definitely something that I kind of realized maybe like kind of late end of secondary school, that's something that I wanted to do. I've always kind of been interested in like in finance and politics and money and business. That was always something that kind of grabbed my attention when I was younger. Ironically, I'm not using it now like in any way. I'm working in a completely different industry, but certainly at that kind of age range, I think that was something that I kind of gravitated towards. And I think even though I'm not using that degree sort of per se now, I think a lot of what I actually learned at university actually kind of gave me those sort of life skills and transferable skills to actually use in a different environment. So although I'm not technically using it, I don't regret doing that, because I think it gave me quite a good like foundation to do other things as well.
Okay, what are you doing now then?
So I've been working for a rare disease publication for the last 5 years. Yeah, just literally this month, 5 years, which has been really good fun. So it's called Rare Revolution magazine, and we're, like I just said, we're a rare disease publication. So we kind of cover rare diseases, ultra rare diseases. We're based in the UK, but we kind of work with different people all around the world. So my job is in business development. So I speak to people in pharmaceutical companies and tech companies, medical students, patients, patient groups. It's really, really interesting. I think that, you know, it's not what, like, full disclosure, it's not what I plan to do, obviously. I think it's something that kind of my life took me in that direction, and I wouldn't change it for the world. But yeah, it's a really interesting way of actually being involved in something, because, you know, obviously I have my kind of personal impact from my rare disease and other disabilities that I have, and I get to meet different people with completely different health conditions and live in different parts of the world. But it's really interesting to hear that so much of it kind of crosses over, whether it's like we just said, like negotiating school, or how we've had to balance work with a rare disease, or friendships and navigating dating or relationships and stuff. And I think it doesn't matter where you are, how old you are, like what rare disease or what chronic illness you have, like we all have a very similar battle that we all have to go through to get things kind of sorted. So yeah, it has been really kind of inspiring to be working in the space, and also as well, I get to kind of see, you know, from like the different side of it, from like the pharmaceutical companies and the research companies and people making medical devices and things. So yeah, I'm very lucky, and, you know, I do quite a lot of volunteering alongside that for Great Ormond Street Hospital, and I'm also a trustee for a catheter charity. It's called My Trophanoff Support. So alongside the volunteer work and my day job, it keeps me quite busy, and it's great. I really wouldn't change it.
So day to day, are there any tips that you can give to people who are struggling with fatigue? So although the conditions that you've referred to are very rare, the fatigue word, that is very common these days. And I don't know anybody who's not suffered from or knows somebody that's fatigued all the time. So what can people do to manage themselves?
Yeah, I think maybe like from a working perspective, I'm obviously very lucky and quite aware that I work from home. You know, I was working from home pre-COVID, so it's not a new thing for me, whereas a lot of people kind of adapted to doing it. I think certainly from a work perspective, if you can work from home, that makes a huge difference, because, you know, like, you know, right now, like, full disclosure, I'm doing this from bed because I'm really tired and I've had a hard day for work. So that kind of thing makes a big difference. Obviously pacing, which you've said, you know, but actually properly pacing, not kind of doing it like I try to do. And, you know, I'm very guilty of not doing it properly, and I do have the tools to do it. I've been taught how to pace properly. I think that it sounds silly, but with my fatigue, like, I build fun things into my day. So like so certainly on the days when I'm not working, like if I have kind of life admin or something that's potentially quite cognitively difficult to do, whether it's like filling out things for, I don't know, council tax or for bills or something like that, that might take a bit of brain power to do. I'll always do the hardest things first if I can, and then do something fun, whether it's, you know, just literally lay down and sleep for a little bit, or have a bath, or do something like mindfulness that I have actually been doing, like, which I've actually been implementing now, or just doing something where you literally don't use any energy whatsoever, and then then you do something else again. So, you know, build it up to something harder that you have to do. So I try and do it in like very small like wave patterns. That's kind of what I found worked for me. You know, I've tried before in the past of doing everything that you have to do very quickly and then having the rest of the day. That might work for some people, but I don't think realistically that's the best way to do it. Also, like, I've tried planning things around medication as well, because I think a lot of people take, you know, strong morphine things or codeine or different kind of strong painkillers, and obviously as a side effect of them, that makes you very drowsy, or it makes you feel like a bit lethargic. So if I'm taking a strong painkiller at lunchtime, say, I wouldn't plan to do anything difficult at like 1 or 2 p.m. I would do something easier then, and that's kind of how I do it. I know it sounds a bit wishy-washy, but I've sort of found what works for me on a working day, and also on like a not working day. I think I've kind of found the balance. I found I know it's very cliche, but yoga has helped me a little bit. It's a bit battle of two swords with that one, because I find it helps with my joints and it helps me feel good, but then the next day I feel terrible after doing it. And it's the same with the gym. You know, gym is great for fatigue in some ways because it kind of expels the energy differently, but it is hard. It's very hard to give advice, because I think that everyone's body is so different, and you have to kind of find what works for you. But I think definitely planning around medication is probably the biggest advice, because, you know, I've been taking strong painkillers for 17, 20 years now, and even now my tolerance to everything is so high still. Like, I'm still can take a lot of painkillers and not really notice it, but in the background it's still doing something. So I think planning around when you know you're going to be fatigued, either from medication or from a working day, or if people have, you know, I don't have kids, but if people have kids or other things in their life which take a lot of energy, it's just planning it around there and be realistic, and don't this is probably the best advice, is, well, it's two things. One is, don't compare yourself to what other people are doing, because that's a huge mistake that I've made in the past, of, you know, looking at what everyone else is doing and feeling dejected that I can't keep up with other people in their early 20s, and that was very difficult for me. I think I burnt out really after university. Realistically, that's what happened. I was trying to keep up with everyone else and trying to think that I could keep up a job in London that I really couldn't do, and I think I really did burn out, and I think that caused a big mental health breakdown and lots of things after that. So that's okay. I'm going to revert to that. That's probably my main advice, to whatever age you are or wherever you're living, you know, whatever your life circumstances, don't compare yourself to anyone, because your body is so different to everyone else's. Plan around that, and that's what will make you happy.
Absolutely. You mentioned relationships is one of the difficult things. So how do you manage?
Yeah, I'm very thankful that I found a really supportive partner. We've been together for just coming up to 5 years as well, so that's been a really good thing for me. I think that when I was younger, I felt I was very late to the kind of dating game and relationships, and you know, it wasn't really, I didn't really start dating kind of until really like early 20s. I was quite late to that, and I think a lot of that was me being self-conscious of thinking, oh, like, nobody's going to want to be with somebody that's disabled or living with these health conditions. And, you know, I'm also a catheter user excuse me, I'm also a catheter user as well, and obviously I thought in my head that would put a lot of people off, but actually, like, I kind of grew in confidence quite a lot. It was actually nothing to do with it as such, but like, I was, after my sort of during this mental health breakdown, I suppose you would call it, I started doing the volunteering for Great Ormond Street then, and that really gave me a lot of confidence in my life. So that kind of, at that point, then I started sort of dating around that time as well. So I think I was so low mentally, just with everything, with my health, and just had no interest in doing anything. And then when I started volunteering, it kind of gave me a big boost. And then that's when I realized, actually, as well, like, oh, like, I'm silly, like, you know, I'm in my prime here, I'm in my sort of mid-20s, I should be going dating and meeting people. And then I did, you know, I had a few different relationships and a few different dates, but yeah, we're kind of where we are now. I'm very lucky that she's very supportive of my rare disease and my health in general, and we have a laugh about it, and I think that's kind of how we deal with things. I think everyone's relationship dynamic, whether you're healthy or not, is obviously different, but I think our one is, we base it around humor. And I know that deep down she worries a lot, and she does get stressed by things quite quickly, so she won't mind me saying that, but I think we're like the polar opposite now, but actually I think it kind of works, because humor is where we kind of navigate my health, because I think without it she would be just constantly worrying about every appointment I have, or every different diagnosis I end up getting, or anything. When you start reading too much into about different, you shouldn't really go on Google too much and learn about your own rare disease or your own disability, because you will always read the worst part of it rather than actually that might not happen to you. And I think that's something when I told my partner Sarah about my rare disease, obviously when we first started dating, obviously the first thing she did was Google it when I wasn't there, and then the next day I remember she was like almost firing all these questions at me about it. So she obviously read up on it. And I think that that's the problem with Google, is that it's brilliant in many ways, and social media is brilliant in many ways, but not everything will happen to you. And I think that's the problem with dating, is that when when do you declare these things? Do you declare it right at the start? Do you declare it halfway in? And actually with Sarah, I told her right at the very start, because I thought, actually, this is silly. Like, why, even though I do and don't want to admit it, like, it is a big part of my life. And I think that, although it's a real nuisance a lot of the time, actually, I think that my rare disease and my health in general has actually probably builded me into, this sounds very cliche, but has probably builded me into the person that I am. I think I have a nice attitude to things. I'm very happy-go-lucky. I'm always trying to see the best in things. I think that that's a good thing. So I don't know why I was trying to hide having an illness, because I think that, my rare disease as well is it's partly hidden and it's partly visible. So it's a bit of both, depending on how you see it. So actually, when I realized and look back on it, why do people, not talk about their disability? It's part of their life. And I think that it's just hard for other people sometimes to think, does that make you appealing to somebody else? And the answer is still yes. Like, I think you just have to find the right person which fits you. And I think that's the same for anyone. So
absolutely. Are there any, you mentioned about social media and Dr. Google and so on. I'm in the natural health world. So
okay.
I've had four different versions of cancer, including stage 4 that I beat in 3 months 8 years
Wow.
ago. And I also had, I was born with a rare kidney disease that I was told was incurable. And then in my mid-40s, I'm in my mid-60s now, but in my mid-40s, I was introduced to chiropractic and nutrition, and I was able to totally reverse my incurable condition.
Wow.
So, that said, my question obviously is going to be, have you looked at ways that you could, have you investigated ways, or are there ways that you're aware of that you could help yourself in the natural world? Because they won't be on Google, they won't be on mainstream media.
Yeah. To be honest, I'm open to anything. So I haven't really tried it, sort of like not in that direction. I've always, as with everything, I've always been very open to trying different things, because I think that you have to be open. I've always gone down the traditional, Western medicine approach, because that's what's worked and worked in most ways. So, but I've always been very open to things. And I don't know if you had any advice or anything that you could suggest, but I would be very open to trying some different stuff, because you never know, like, it might work for you, and that's a bonus.
Exactly.
If there is anything that works, and that's a bonus.
Yeah, this is a thing. We'll talk offline about it, but I've supported a lot of people with all kinds of conditions over the years. MS is a typical one. People get a diagnosis of MS, and very often actually it's not MS they've got a mineral imbalance. There's all kinds of other reasons why symptoms of MS. I have a client who was on 9 different medications. The side effect of all those medications matched some of the MS symptoms, many of the MS symptoms.
Right. Okay.
So there's all kinds of different ways to look at things, and I think it's very interesting. Obviously, with having a diagnosis so very young, the medical model, has kept going and kept you going, but also the fact that your condition is so rare, you must be quite a sought after commodity in the scientific and medical world.
Kind of, in some ways. I think this is when you have this ultra rare condition like I've got, I think that being like this, for me, like, I think a lot of people say, it must be quite not interesting, because that's the wrong word, but you know what I mean, like, it's a bit of a novelty having this ultra rare thing, but obviously the novelty wears off quite quickly when nobody has a clue what it is. If I go to A&E somewhere, even in the A&E hospitals that know me, like for the clinic stuff, they haven't got a clue in A&E. Or if you go to a new GP, they're pretty much not aware of it. Well, they only Google it. That's the only other thing they do. And I feel like a lot of my medication that I take, just to go back to that actually, so kind of what I said about the fatigue part, where I take a lot of medications for different things, whether my bladder, my kidney, or my joints, or whatever it is, and I feel like they kind of obviously all of them cause fatigue. I think nearly every medication, if you read it, will say it causes fatigue. So that's not the right thing. But sometimes, I take something for my, I take like a heart sort of steroid, I guess, which kind of lowers my blood, raises my blood pressure. But I take another thing for my bladder, which crosses over and kind of counteracts what the other one's doing. So this is the problem, I guess, with my medication in that respect. So the painkillers is a separate thing, but kind of some of the medications that I take for other stuff for different organs kind of cross over, and they don't cancel each other out, but what I take one for kind of counteracts the other one, which is, I've kind of massacred the way of explaining it, but that's something that I have noticed, kind of the more medication that I've started to take. And I take 25 tablets a day or something like that. It's definitely a lot, and obviously lots of different medications, so kind of balancing that part of things has been quite difficult, over the years. When I was a lot younger, I was only taking sort of 2 or 3 medications, and it went up to sort of 5 or 6, and it kind of has grown since then. And obviously the state I'm in now, it's very hard to come off things, or it's very hard to know what would work, because it's not something common, say like breast cancer, where there's so much kind of research and so many cases that you can kind of work out trends and what would maybe work for me. Like, it's when you're in this kind of rare or ultra rare thing, sometimes people don't know the right route for you because there hasn't been a route before, because you're the first person to go down it in many ways. And as far as I know, I'm the first person that's maybe ever had occipital horn syndrome in the UK. It could be people having it before and being misdiagnosed, but as far as I know, that's the case. So it's difficult for me to know what is the right route for me, because there's not any research really out there to prove it either way. So I've always been kind of very open to different things and trying stuff. So very happy to talk to you another time about that.
Okay, wonderful. The fact that you're so positive is a huge factor. The people that I support, the ones who are assuming the victim role, they are the ones that don't get better, whereas those who are positive and resilient and so on, they do very well. So the mindset is a huge thing to do, and you've cracked that by the sounds of things. So well done.
Thank you. I mean, it's a bit of a battle. Obviously, I think that's the one thing. I think obviously I've definitely not always been. I've always been happy-go-lucky, but I've always had different points. I think I've kind of, my 20s weren't great, I think, in many ways, apart from a few things, but realistically, I think I've kind of flourished more in my 30s. I think that I certainly haven't cracked being ill, and by any means, it's always going to be something that I'm going to have until the day that I pass away. So I'm never going to completely know how to manage it, but I think I've kind of got a better hold of my health in my 30s and sort of finding out what works for me. But I think the positivity part of my health is that's sort of what's helped me keep going. I think that when I was really struggling, like, I didn't want to make that. I think this is when I realized that I was really struggling mentally, where I didn't really want to see friends of mine that much. I didn't really have any ambition to work again, or I didn't think I would be with anybody else in a romantic situation, or all these different things. I think that was obviously, I was feeling like incredibly low at that point, and my sort of mindset and where I'm at now, and been living with my partner for quite a long time, and obviously been together for a long time. I've been in a steady job for a long time, and I think all these things are, even though I said you shouldn't compare to people, I think earlier, these are kind of tick box things that I kind of wanted to achieve, and I'm doing it. So I want to kind of keep this upward trajectory as much. Obviously things might happen. My health might change in my late 30s or my 40s. I have no idea what's going to happen. But while life is good for me, mostly, I want to keep going in that direction. I think the mindset part of it has really helped push me out of it. I know it is cliche, but I really do think that my mindset has been the thing that kind of gets me out of bed and keeps me working, keeps me trying to make an impact in rare disease, keeps me volunteering, all these things that mean a lot to me and make me feel good. Like, at the end of the day, I think that's kind of what I'm trying to achieve. So yeah, I mean, if the mindset is something that's powerful, then I think I agree.
Absolutely, definitely. Well, you're certainly an inspiration, and
Thank you.
it'd be wonderful if we could get you a bit more comfortable in the future. So we'll see what can be done on that. So thank you for speaking with me today, David, and sharing some of your life. How do people get hold of you if they'd like to, or are you? And I know you're quite active on LinkedIn. So I mean, is that the place to connect?
Yeah, LinkedIn I use a lot for my kind of day job, and it kind of blurs over connecting with people anyway. So I'm always kind of active on LinkedIn and talking to different people. So that's probably the best place. I use Instagram as well for kind of my rare disease and health stuff. So the name on Instagram is and then Occipital Horn Advocate. That's probably the two best places to reach me. So yeah, come and connect with me on there, and we can have a chat.
Okay, so at Occipital Horn
Advocate
on Instagram, and David Rose on LinkedIn.
That's it. Yeah, it's David Edward Rose, because I put my middle name in because there's so many David Roses on LinkedIn.
Okay.
I put my middle name in to try and make it easier.
Okay, wonderful.
Excellent.
Right, thank you for your time today, David. I wish you well.
Yeah, thank you, Elaine. That was good. Really enjoyed it.
Thank you.